Hi, I'm Brian Duncan, and this is Blaine Schmidt. We're excited to talk to you today about growing athletes and workout and rehab principles for your young individuals. And we're really excited that we get an opportunity to follow up on last week's discussion by Dr. Mansour and Dr. Traver on injuries with the growing athlete. Blaine, will you tell us a little bit about yourself?
Yeah. So like you said, my name is Blaine. I've been in the mobile harness system for almost 6 years now. I've been in the Houston area for about 6.5. I've been working with youth athletes throughout this whole 6 years, and then prior to my time down here as well, for the 4 years before that, I've been working. So about 10 years I've been working with youth athletes, all the way from starting out to elite level youth athletes.
Yeah, and so like I said, I'm Brian Duncan. I have my doctorate in physical therapy, and I'm board certified in sports and orthopedics, and I've had the opportunity to work with youth athletes across my almost two decades of clinical practice now, and I get practice around the house as I've got 5 young kids ranging from 4 to now 13, and so yeah, I get a lot of practical experience at home along with the experience in the clinic. All right, Blaine, so one of the big questions is, what are the primary goals of strength training and physical fitness when we're talking about the skeletally immature athlete?
Yeah, I think from a basic standpoint, there's a couple of base things before we get into too much detail, but promoting athletic development is a primary goal. Allowing them to tolerate the long loads of season and competition training, so forth. And then just promoting a healthy lifestyle, healthy habits for their long-term adulthood as well.
No, that's a good point when you're talking about getting them exposed to different sports and then developing loads. Can you speak a little bit more to that? Yeah.
So when we start them out, the first goal is body awareness. So we want the youth athletes to be able to move efficiently before we put any kind of external load on them. So body weight, or whether it be with a dowel or a light PVC pipe as their external weight. But being able to move efficiently before actually loading them with weight is kind of the first step. And there's a couple of different models that we can go over today, where they kind of lays out the steps in really basic terms of kind of how to progress through those different levels. And the first one it's called long-term athletic development, and they break it down into 7 steps, and it's 1, active start. So whether that be running in the backyard or playing in the playground or something along those lines.
I remember rolling balls to my kids because as a new dad, I'd throw a ball to them and they'd look at it and then it just hit off their chest, or occasionally, unfortunately with my aim, their face, and then it bounces away and then their hands come together, right? And so you're like, okay, well maybe I should be rolling balls and playing chase and hide and seek and those kind of things, and then it progresses.
So once you get them moving and they can progress to the next step, it goes fundamentals, and they capitalize fun, F-U-N. So really non-structured kind of drills or activities or games. That's also kind of reinforcing fundamentals of human movement and kinesiology.
Right. Yeah, and I think that's good from our kines degrees is talking about if it's too rigid and not fun, you're not going to have a participant. You're going to be out there trying to play, and you force so many boundaries on your kids that they're not going to be moving about, they're not going to enjoy it, and they're going to move on without you. Blaine, when do you go into this learn to train phase? Is there an age range? I know it can vary from child to child.
And this model here actually is a little bit more in the chronological age, which is their age in years, from 0 to whatever age it is. And so typically what I've seen is around like junior high age, when they start to get into more structured sports, structured activities, they're more willing to. Once you get a little younger than that, if they haven't had a lot of exposure to that team environment kind of stuff, they're still maybe a little green for that type of training. But definitely once you get into some structured sports environments is a good time.
And practically speaking, I've seen that in that I used to go to the YMCA quite a bit pre-COVID, and my daughter wanted to come upstairs, and yesterday she turned 13, and so I brought her upstairs at around 10 and exposed her a little bit to weightlifting, but her attention span was about 5 or 10 minutes, and I'd want to keep lifting and doing my workout, and she obviously couldn't keep up. And me as a new dad, as that being my oldest child, I'd read this, but actually seeing it express itself. So I completely agree. Whereas now that she's 13, honestly, I can keep her busy for about a half hour in the gym, and then her time span or attention span's kind of winding down. And I know that'll grow as her interest in sports and being good at the things that help you improve in your sport, change and mature. But I think you're right on, around the middle school age. And so what are those next steps?
Yeah, so the next three are kind of like intertwined, where it's train to train, train to compete, and then train to win. And so that kind of progresses as they progress in the weight room, as their efficiency in the weight room increases. Then you train to train, and then you train to win, whatever. Then you get sport specific. And then the last one on this whole 7-step development model is active for life. So just promoting healthy lifestyle choices and making the weight room fun, or making exercising fun, so it's something they can carry with them throughout their life.
And I think we'd probably like to emphasize that is that we want to train and develop behaviors that will help your child not only now, but as they mature and spend their life outside of high school or college. So few people go on to play college sports. Having the ability to have foresight to basically help your kids develop patterns, just like in school, that are going to help them. And so looking at those fundamentals, keeping things fun, then exposing them to learning to train. So rules of the weight room, rules of running down the bayou, passing on the left, and those kind of things, and helping them get acquainted to what more experienced people, whether it's resistance training or running or whatnot, are exposed to. And then it gets more and more formalized when we go from middle school to high school. And so
and that can be kind of tricky too, because not all athletes are the same at the same age.
That's a great point.
And so this next model that we have in here is the youth physical development model, and that goes based more off of biological age. So kind of how much are they maturing compared to the rest of their classmates, or where are they at on the physical kind of spectrum compared to everybody else?
Yeah, and I guess speaking as a parent, you'll see your kid out there, and maybe they're not performing as well as you'd like them to perform, or maybe the sport isn't clicking as fast or whatnot. And I just say, be patient. Kids mature in their athleticism at different rates, just like they mature in the classroom at different rates. And I have a daughter who's 13, and she's 5'9", 125 pounds. And my son, who's 2 years behind her, is only 65 pounds soaking wet, right? And so she's hit puberty, and he's not even close. And so that is just kind of an example of, I can expect him to develop like her, but my expectations are going to fail me because he's just not physically mature. And when those hormones kick in and when he goes through puberty, things will change pretty rapidly. But to expect him to do things that a more mature athlete or that matures early does, like if we talk about baseball and velocity, or running and sprint speed, and sometimes it's coordination, and we should just hedge our expectations a little bit that all of our kids are going to develop in a little bit different pattern that's unique to them.
Yeah, and this model really paints a little bit more clear of a picture than the first one we discussed of when to implement those different types, how you asked of when do you really know when to advance them.
Right.
This model kind of gives you a better picture because it goes off of peak height velocity or peak weight velocity, or in more like regular terms is a growth spurt. So there's certain things you want to focus on pre-growth spurt, certain things you focus on, mid peak height velocity, peak weight velocity, and then things to focus on post. So
will you talk us through that? So so those big growth spurts is, it happens at different ages, but but around the middle school age, particularly for girls, and sometimes a little later for boys. And will you tell us, like, let's start pre-growth spurt?
Yeah. So pre-growth spurt, you're really working on just body awareness, being comfortable moving their body in space. That's really the main priority, and that goes back to the fundamentals part of the previous model.
So like how to squat,
correct,
how to lunge, how to do a forward roll, do a jumping jack, things that we consider coordination, how to catch a ball, how to kick a ball, things that will then open up doors into other sports, those sort of things.
Yep.
Is that kind of what you're speaking
running
of?
mechanics, jumping mechanics, all that kind of stuff. So when they do hit that growth spurt and those hormones come on, they have the foundation. So when they start putting on, more mass, or their body starts to change a little bit, they're able to handle themselves without increasing their risk for injury. And strength is also one that it should be incorporated throughout all of the phases, which is kind of counterintuitive, because you don't typically think of strength as something you want your 8-year-old to be doing.
Yeah, so talk me through that. So we field questions on, is strength training or training in general gonna stunt my child's growth? Is it gonna harm their growth plates and those kind of things? And can you kind of talk us through that?
Yeah, there's a lot of those types of opinions that have came out that have been debunked, but they still carry on to this day because they've been around for so long. And so that is a common issue, common question I get from a lot of parents is, it's going to stunt their growth. Maybe if you do the lifts wrong, but that's why it's important to follow the steps, to have the fundamentals down first. And strength is also a multifaceted term. It's a very relative term too. So strength for me and you could be different, or strength for me and another person could be different. But there's a couple different things involved in strength besides just moving heavy weights. There's a neuromuscular factor that's involved, as far as muscle firing, muscle recruitment. And if you're able to, improve those things when they're at a younger age, that'll carry over to when they are able to start producing some more hormones and they can start using more weight. It'll carry on. Their body will be efficient in those aspects.
Right, and I think when we talk about the nervous system, just like kids learning to read or learning their math times tables, maybe is a very good analogy as a kid learning to jump rope. Right, when they first learn to jump rope, it looks terrible. Right, and then with more and more practice, it becomes smooth, and then they're barely getting off the ground, and that rope's moving faster. And all of that is not because they got any stronger, it's because the nervous system is able to process and calibrate that movement a lot more efficiently. And so all this movement, getting our kids off the couch and away from video games, is all about just exposing them and helping their nervous system adapt. Actually, just like it would a video game, I know I played some with my kids, and oftentimes I get smoked, right? Because I grew up with a remote with an A and a B, and maybe some buttons here, and now it's 3-dimensional, and so my brain doesn't adapt. As an older, more mature person, my nervous system doesn't adapt as quickly as theirs does. So the beauty of being young is your nervous system, your neuroplasticity, is amazing. And so kids will pick up things really fast if we expose it to them pre-puberty. And then during puberty, there's the changes that boys and girls go through, and testosterone and growth hormone, those are the keys to adding size and muscle mass and strength. And both sexes are going to get those. What you'll find, or what I've seen, is that boys get disproportionately exposed to resistance training, where the female athlete will get disproportionately exposed to their sport repeatedly. And so what I think you and I would probably emphasize is that females deserve just as much time in the weight room and should find time to make time for that in their training regimen, because of the performance enhancement that it provides, for the injury risk reduction that it can help provide. And then there's just awesome things for long-term bone health, and other things. And we talked earlier about right? Behaviors we want people to be comfortable with, and if we can make sure that boys and girls are comfortable in the weight room as they're going through puberty, the chances are of that lasting and becoming an adult behavior are much higher.
Yeah.
So things to add to that.
Yeah, no, you covered it pretty well. Once you hit the puberty area, the peak growth height or peak height velocity, peak growth velocity is when you want to start focusing more on hypertrophy, putting on mass, because the more mass you have, the more strength you can have, and so on and so forth.
And sorry, I didn't mean to cut you off, but I'd also say, and this isn't our specialty, but our dietitians are phenomenal at this, but the caloric demands are going to increase, right? And so you need to make sure that your athletes are eating enough calories, and the timing of those calories can be important, and also enough sleep. So sometimes we spend so much time training between school and then sports and then homework that some of our student athletes are getting 6 hours of sleep at night, and maybe us adults can get by on that with a cup of coffee, but kids, if we're expecting them to grow or maximize their gains from their schoolwork and their physical training, they need more rest.
Yep.
Would you?
100%.
Do you see that in the athletes that you're training?
Yep. The best proven thing for recovery is sleep. So. Right.
And so in recovery, we could do a whole different talk on that, but it is kind of the key. Is one of the key components that's often missed. But the Olympians you're watching, on TV, they're not missing that component. They may be not sleeping well because they're nervous before the biggest performance of their life, but that is very definitely integrated.
Yeah.
Your pro athletes, that's going to be integrated as well, especially as they mature. Like we look at LeBron James and his longevity and his behaviors at 18 when he was in the league are probably quite different than 36, but there's a reason he's still playing at such a hugh level. And so,
another thing that you brought up is just the fact of being comfortable in the weight room, whether male or female, I think is hugely important when you get into that team setting, high school setting, because most of the weight rooms are understaffed, and if you have a team of 30 people in there, the chances of some bad form slipping through the cracks is very high. And so if you are competent from a younger age, moving into that environment where you may not necessarily need a lot of attention, can help you keep continuing to gain and make those growths as you get into that team environment in high school.
Yeah, that's a very good point.
Yeah. And one question I had from your perspective is, one of the bigger things that you see kind of causing injuries in this type of athlete?
Yeah, so kids are really resilient. It's a great question. And so injuries are going to vary based on sport. And so, you might see ankle sprains in soccer, or as the kids get older, ACL injuries, particularly in female soccer, ankle injuries in basketball, knee injuries in football, shoulder and elbow in baseball. But in general, I think a lot of injuries can be avoided if we're rotating through our sports, right? Just like in the weight room, there will be training that towards a peak, right? Like if it's football season, I'm working hard. And then during the season, I'm just trying to maintain my strength. I'm not lifting with the same loads I am in the off season because I'm focused on football. I think if we take that same concept and back it down to our prepubescent athletes, if we can help them transition from sport to sport during the season. And so, my daughter, as she was going into middle school, I asked her to play a sport 3 out of the 4 seasons. And so fall, she chose volleyball. Winter, she chose basketball. Spring, she wasn't sure she wanted to play a sport, so I told her, if you don't want to play a sport, that's fine, but then we'll swim during the summer. She didn't really want to swim, so we came back around to track. And so, and she's not gifted in track, but developing the ability to run and the confidence that I can run transitions to all the other sports, which she really loves. And so I think getting that variety, and if you're a baseball player, giving your arms some rest, right? And if you're a soccer player, maybe just backing away from the game gives you a mental health break and doing something that maybe you're less competitive in, but it forces you to be a good teammate and to not be the person who's the most skilled on the field. And then trusting that as your child develops, they're going to fall in love with something. And then if you want to specialize in something, waiting till high school is a great option. You know, many of the people you're watching on TV in the Olympics or in professional sports played multiple sports in high school. I know that's getting more difficult as the size of the high schools grow and the competitive level at a younger age grows. And then there's the X factor, right? J.J. Watt played all these different sports. A lot of our pro athletes did, but they're also genetically amazing. And so they could start later, or they could do different sports and not specialize early because they're so gifted. All right, so Blaine, a big question I think I hear from parents, and I think you can speak to, is what about pain? Like pain, should a kid come home from practice, or let's say a resistance training session or agility session with you, should I expect them to have pain? How do we work through that?
Yeah, so if someone came to me, parent or athlete, with concerns of pain,
Right.
the first thing we would check would be form on the lift or mechanics in the running. Is there anything blatantly popping out with their technique?
Right.
If not, then do we check load? So if they have pain with the squat, do they have that same pain if we decrease the weight to a body weight squat?
Right.
And then if that is no issue there, they still have the pain. Well, where's the pain at? Is it muscular? Is it somewhere else intra-articular? Where are they feeling the pain at?
Yeah.
And then my next question to them would be, what's going on besides lifting? How's your diet? How's your sleep? Are there any big stressors that just happened in your life that that may have spiked some kind of reaction in your body? And if we answer all those questions and there's still pain, then that's when I would refer to physical therapy, orthopedic surgeon, physician, someone who could answer that question more.
And I think in our environment, since we actually get to work together on a daily basis, we get to have these conversations with patients kind of on a real-time basis here in the clinic. But yeah, if your athlete's coming home and they're sore, that's probably to be expected. But the longer that soreness is around, and if they're telling you they have pain, if they're pointing, it hurts right here, and you touch right there, and then that bothers them, that's when you start to elevate your level of concern and think about, all right, do we need to consult like an orthopedic surgeon? Do we need to consult primary care sports medicine or a physical therapist? All of those are good options. The nice thing with kids, especially prepubescent kids, is rest heals many of these ills. And if it doesn't, even more important to get a consult in a timely manner, because kids' metabolism are so rapid that they stop aching, they heal like us adults would like to. So we pop Advil or Tylenol and take some rest and we feel better. They don't need all that. Usually it's just rest for a few days and they should start feeling better. And if they're not, then you're gonna want to consult one of the providers at UT Ortho, or try one of the physical therapists at Memorial Hermann, because those do deserve a second look. And sometimes there's imaging and whatnot, depending on the injury or the pain. And maybe another concept to talk about is, we've talked about kind of pain, but what about like training? How does training vary? So we mentioned earlier on, like training during the season looks different than the off season or the ramp up back to the next season. And can you just real quickly provide a kind of glimpse into that?
Yeah, so at the base level, in your off season, your whole goal should be getting prepared for the season. So, and this is your time where you can really push things because you're not doing a lot of other things involved in sports or activities.
Right.
So we can really load up on strength and conditioning.
Right.
Preseason is kind of like the cherry on top. You're trying to get the finishing touches on any kind of strength gains, power gains,
skill development,
yep.
that sort of thing.
Yep.
And then during the season,
Yep.
are you lifting all the time?
Yeah.
So how does it look?
Yeah, so you'll see a decrease in the amount of times that you will lift.
Mm-hmm.
Generally, I'll recommend 2 times a week.
Right.
And what I do is a lot of strength training. So low volume,
Right.
higher weights to try to maintain those gains that you worked on in the off season.
Right. So not a lot of reps.
Yeah.
But we're running through, we're lifting things a few times that are heavy, working the whole body, and making sure that we're not overstressing you such that you're not doing your primary thing, whatever that sport may be, and so that you've got the energy and the focus to aim at that sport without having your strength decline over the course of the season.
Correct.
And then when you start the off season, and like Blaine said, it's your opportunity to develop for the next season, and part of that development, and we touched on it earlier, is just rest, playing different things, not playing the sport you've been playing. Where it's summer now, and select baseball is going on, and tournament baseball for all-stars is wrapped up, but that's a lot of demand if you're in baseball and softball, and kids have thrown every day since February. And so having days off where you're not throwing and you're kicking a ball or doing anything but playing baseball or softball is phenomenal.
Yeah.
And then you can regroup in a couple months after you've given their arms some time off and looked at other sports, and they've gotten some mental rest, and then you can get into that physical rebuilding and preparation for the next season. Obviously, this gets much more intense when you move into high school and college, and when you're prepubescent, it's all about just getting exposures to different sports and developing different skills that are transferable. So.
Yeah, I think that's definitely one of the biggest variables that gets kind of overlooked, especially in today's world, is the rest.
Yeah.
Everyone thinks more is better, but that's definitely one thing that you need to keep in check is rest and recovery.
Right. Absolutely. Well, we thank y'all for joining us on the UT Game Ready series. We thank the UT orthodocs, who we love to collaborate with, so the orthopedists and the primary care sports medicine docs. And if you have any needs on the rehabilitation side, physical therapists and strength and conditioning coaches at Memorial Hermann are here to serve you as well. We love operating in a collaborative environment here. Thanks again for joining us for Growing Athletes and Workouts and Rehab. And if you haven't already, check out the Injuries to the Growing Athlete by Dr. Traver and Dr. Mansour.